My name is Dr. Joan Sonneborn. I'm Professor Emeritus from the University of Wyoming in Laramie, Wyoming. And my talk was mainly on the use of mimetics of hormetic agents. And the idea was that what we did was look at what nature has conserved from the lowest animal to the highest animal. And those things that are conserved are the really triggers that can control metabolic processes and intervene in all kinds of illnesses. The hormetic agents I was most concerned with were radiation and hibernation as a tool to interfere with ischemic hormetic agents. And I'll go first to the UV radiation. And in the UV radiation, using paramecia, a long time ago, I saw that you could increase longevity of the paramecia with UV radiation and photoreactivation. And extending longevity, which normally would be thought of shortening the lifespan, instead increased the lifespan. Most recently, we've been working with mimetics of hibernation, and hibernation is involved with ischemia, hunger, and thirst. And during hibernation, it's been known that the plasma of a winter hibernating animal contains an opioid. And that opioid we thought might be possible to be used as a mimetic of the hormetic stress, and see if we could have animals be protected against first a heart attack. And using rats and an occlusion to the heart, we were able to show that if it was pre-treated with a deltorphin, that they would have less infarct damage and were less stressed. The other ischemic activity that we looked at was mild hemorrhage. In mild hemorrhage, we found that instead of the blood pressure and heart rate cratering during the heart attack, the pretreatment with the deltorphin prevented that from happening. In severe stress, the animals were under a great deal of stress and were lacking oxygen, but post-treatment with the deltorphin increased lifespan and allowed them to tolerate this very severe trauma. And I think this is potential for a lot of clinical interventions, especially when hemorrhage can be treated after the event happens, not just before. The other thing was, with those experiments, we did not need fluid replacement. And so you can imagine in various scenarios, an accident in a remote area or in a military situation, the ability to give an injection which would protect the individual until they could get to a trauma center might have wide applicability. The idea is that, and most recently in another person's research on a group of scientists working with exercise, they found focusing on a key regulator that controls the amount of fuel a cell has by focusing on that particular molecule and getting a chemical that acted like a lack of AMP in the cell, they could mimic the turn-on of the energy and exercise cascades that exercise normally would give you. So these are examples of dramatic effects of mimics of hibernation that trick the cells into thinking that they've done that exposure to that traumatic agent. The other incidents in UV radiation, which I spoke of earlier, work by Barbara Gilchrist and her colleagues, have shown that a thymine dimer is a mimetic of UV radiation, and in some cases they've shown that it can prevent cancer of the skin and can even cause tanning in the organisms. In summary, by tricking the cells into thinking they've been damaged, and they haven't been damaged, you can trigger the benefits of what the damage could induce, which could actually be result in rejuvenation in the animals. Thank you very much.